The WWYP approach is basically a new methodology that teaches health professionals how to conduct productive meetings with their patients. WWYP, which writes WWYP, stands for Work With Yourself, Work With Your Patient. And it means exactly what it says, that health professionals need to be able to turn the mirror on themselves first in order to be able to counsel others. Well, I believe that the relationship between health professional and patient is the building block of any healthcare system. And if we have that in good shape, then I wouldn't be exaggerating to say that we are affecting the entire healthcare system with it. So the meetings between health professionals and patients basically determine the quality of their relationship and how much each party is willing to put into that. So having and adapting a successful methodology like this approach transforms the quality of the entire care that we provide. Well, we health professionals know that one of the most difficult things for us to do is motivate our patients. And that is especially true for chronic conditions. Now, what this methodology does is that it creates an appropriate platform of communication between the health professional and the patient, which in its turn creates and facilitates time-effective and cost-effective shortcuts to true diagnosis, to the end goal, and to motivation. So let me give you an example. A few years back, this lady walks into my office. She was obese, and obviously she wanted me to help her with her long-term struggle in managing her weight. She told me that she had gone to every dietitian in town, to different physicians. She tried every dietary regimen that's out there. She registered to the gym on and off, and a friend of hers referred her to me for yet another opinion. So after we got down the basic information, we started talking. Within a few minutes, she stopped, and she said that she wanted to say something to me that all these years she had not discussed or talked about with anyone else but her psychiatrist. And that was that she has been an abused child and an abused adult later. So what just happened there? With this method, the suitable platform of communication was created between health professional and patient from the beginning of the discussion, where for the first time this patient felt confident, trusting, and comfortable enough to bring to the surface information that she knew was affecting her efforts. She didn't know how or why, but she knew it was important and it was connected. This, of course, exposed the real diagnosis, and from there on, we worked through the methodology step by step, reaching the actual goal. Now, had that not happened, the diagnosis would have been totally different, and the end goal as well. And she probably would have walked out of my office with a dietary regimen or some dietary instructions in her hand. Luckily, that did not happen. Now, motivation comes from seeing results and knowing that you have genuine support. When you see that the pieces of the puzzle come together and you are beginning to see the real picture, that is extremely motivating for both patient and health professional. And that is why we want to use this approach. I was intrigued by this topic from the very beginning when I was very young and I was a volunteer in a hospital, and later at the early steps of my career when I first started to learn how to counsel patients. And I realized then that there was an underlying gap or a distance between health professionals and patients. So I decided to get involved in the domain and investigate first and foremost where we stood in patient approach at the time. And to make a long story short, further education, research, continuous work, and sessions with patients, and then I joined associations that deal with the topic, and I occupied key positions in those organizations and associations. And that gave me the opportunity to meet and collaborate with the pioneers of this domain and wonderful people who have made incredible steps forward in this topic. But at the end of the day, it was still the same thing in my mind, that there was a need for something different, a new approach, a new methodology. And the solution in my mind was simple, to create a new methodology. And that's exactly what I did. So in 2009, I started putting together this theory. 1 year later, I presented it at a conference, what the need for a new methodology and the results I had so far. And I remember that was after my first workshop using this methodology. And the results were so phenomenally great that it really validated my belief in what I was creating. And I was sure that my passion for it would be an incredible drive. Shortly after, the theory got its official name, the WWYP approach, with the principle that health professionals would be trained in counseling and its methodology in order to be able to have better outcome, reach goals faster, and have less costly results. Talks followed, workshops followed, the media showed interest in this, and in 2017 I was invited to submit it as an editorial in a medical journal. How successful? Well, the results show that 82% of participants, about 82% of participants, claim that their sessions with their patients have favorably changed. They have improved after attending even one workshop, while 33% of them wished to be trained further. And I am really very grateful, and I truly appreciate every talk and every workshop, because I feel that every time it's one step closer to a better healthcare system. Oh, I would say increased patient satisfaction, definitely. A more patient-centered care, which means better healthcare.